Hi, myself Dr. Manjunath. I'm an IVF specialist working in Matrutva Fertility Center in Bangalore. Usually the first cycle will be successful quite often times in a well-maintained, good quality clinic. But unfortunately some couples will have to face an unsuccessful first cycle. Yes, definitely you need to try for a second cycle because that's going to have you a good success rate. You will hope for that. So when you are trying for a second cycle, make sure that all the parameters, all the factors should be optimized. Yes, after one failed cycle, lady will go to such an emotional disturbances. She will shut her completely out of contact and she will suffer that pain, suffer that dejection, suffer that failure, lonely. But most of the time even men will have the same kind of emotions, but nobody is there to share their pain. So what you need to do during that time, please don't take any hasty decisions, recoup yourself, give some time for yourself. Don't go and consult your doctor immediately. Take 1 or 2 weeks off, give yourself a time, say a week or a two, then have a consultation with your doctor. Sit and review completely what all went wrong. First take an appointment after 1 or 2 weeks and go and sit with your doctor, your infertility doctor, and review completely what exactly went wrong. What was the exact reason for you to go for an IVF? Whether any problem with the egg development, or any problem with the drug chosen, or a protocol which you had, that means a stimulation protocol, and any problem in the embryo development, any problem in the embryo transfer, or any problem with the sperm parameters. So sit and review this completely. Then make a choice what went wrong or what you need to do further. Most of the time for a failures in IVF cases is embryo, the embryo which is developed from the both egg and the sperm. So embryo development problem means either there will be egg problem or a sperm problem or a lab condition. So sit and review which of these things went wrong. If it's an egg problem, find out what exactly went wrong, whether it was a problem with the drug or the egg itself. If it's an egg itself, then try one more cycle with the own egg. Even if that cycle fails, then definitely an egg problem. But if the embryo was a beautiful embryo, high grade quality, then look for any other problem, like any problem in the endometrial receptivity. When it comes to the endometrial receptivity, I would say very small proportion of the couple will have this endometrial receptivity problem. So you can find out this endometrial receptivity problem by doing some test called as endometrial receptivity test. At this point of time, decide an important question whether you need to change a clinic or a doctor. One advice is, if there is a good quality embryo developed, don't change the doctor or a clinic. Try and see that for a second time. Especially if you have a stored embryos of good quality, go and meet the doctor and do a second cycle with those stored embryo transfer called as frozen embryo transfer. But in case of bad quality embryos, yes, maybe you can change the doctor or a clinic and see and attempt a second cycle in a different clinic or a different doctor with a different protocol. So you may ask, what is the chances of getting pregnancy in my second cycle? If all the parameters are optimized and if the case is not so complicated, you will have almost same success rate as the fresh one, as the first cycle. So try and look into those factors which is not taken care in the first cycle and don't repeat the same mistakes in the second cycle. You may ask how long we can give a gap before trying a second cycle. There is no particular thing like you need to give 6 months or a 1 year gap. What I would say is, if you are emotionally recouped, all your emotions are addressed and you are clear of your mind that I am ready, yes, that's the time when you go and try your second cycle. I would say maybe 1 or 2 months gap is ideal to recoup to have that emotional healing so that you can confidently go and try a second cycle. All the best.